Many IBD patients are fearful of introducing fruit into their diet. What do you recommend?
That's a great question. A lot of my patients ask about how to introduce fruits into the diet. For our patients with active symptoms, an ileostomy or a stricture, I often recommend texture modification. That means peeling their fruits, making sure they're nice and ripe and soft, and even pureeing them into a smoothie. For patients who haven't had a lot of fruits in a while, I often recommend starting with bananas. It's a nice soft texture for patients and usually well tolerated and full of nutrition. Avocados are actually another great option, especially for those patients who are looking to gain some weight. I often recommend putting it on some toast with a little bit of lemon juice. It's a great treat for our patients and full of nutrition.
Those are some great options, and in addition, soft melons such as papaya, as well as soft ripe peaches, if you peel them, can be also really nice options. Super soft, and they're also packed with nutrients like vitamin A, vitamin C, and potassium.
That's such a great recommendation. A lot of patients ask about apples. I think this is one that comes up a lot. And so what I often recommend is if a patient has had some symptoms with an apple before, or maybe they're a little hesitant to have it, I recommend starting off with applesauce. If they tolerate that well, which most do, they can move to a peeled apple that's nice and thinly sliced. And if that goes well, they're usually able to tolerate a regular apple with the peel thereafter.
I also get a lot of questions about berries. Berries can be a tricky one in their whole form because of all the seeds, but if you pulverize them into a smoothie, they tend to be pretty easy to digest. I like to have my patients think about foods fitting through a strainer. If the food particle size is really small, such as in a smoothie, then you're more likely to tolerate it.
What do you both think about canned and frozen fruit?
Those are really great options. They tend to be really nice and soft, and also frozen fruit is super nutritious. I think it's a common misconception that frozen produce isn't quite as nutrient dense. However, it is frozen at peak ripeness, which preserves all of the vitamins and minerals. It also tends to be a little bit less expensive, which can be a nice option, and it won't go bad. It stores in your freezer for a pretty long time.
I also love that most frozen options actually come peeled already and they're chopped up, so it saves patients a lot of work in terms of preparation. You also asked about canned fruit. That's a great question. A lot of our patients do well with canned fruit as it's really soft and it's often already peeled. I recommend that patients purchase options that don't have added sugars and they aren't packed in syrups.
Thank you both so much. I really appreciate all the tips, and I'm gonna add more fruits into my diet.